In our practice today, we're going to restore the health of our knees by using some of these exercises to eliminate knee pain and restore the strength and flexibility of our knees. You will need some kind of a cushion, a towel rolled up, or a blanket, and a block if you have one. Knees take orders from the hips. In order to restore the health of our knees, we need to start back here in the pelvis, in the hips. Slide the soles of the feet forward and open the knees as far apart as one of the knees, if it's stiff, will allow. So it may look like this, or you can bring it back to here. Baddha Konasana, or butterfly pose. Then we start just by gently wiggling our hips open, getting some lubrication and synovial fluid in the joint. And once you feel like you've noticed the hips are a little more flexible and open, tip the pelvis forward with a straight spine, but pull your navel back and take a deep exhale and just allow your body to come forward. So we use like gravity and the weight of our upper body then to increase the mobility of the pelvis and open up the hip. You'll also feel this in your back. So we'll take 5 breaths right here. Inhale, and then exhale, let it go. And slowly come back up, and a few more butterflies. Bring your legs together, slide them to the bottom of your mat. Remove the cushion from underneath. Then take your towel that you've rolled up or a blanket and take it underneath the knee that's causing you some discomfort and challenge. I'm going to lean back a little bit and press this knee into the towel or blanket like you're squishing it. Contract and release about 10 times. And on this last one, we're going to hold it for the count of 10. So you're just pressing down really hard with the back of the knee. Notice the quadricep is contracted. And release. Now repeat it again. This time I'm going to flex my foot just as an option and press again 10 times. Now if you look down right at your quadricep, you'll see right here where that quadricep attaches to the knee and keeps the knee in place. And then hold it. So I'm pressing down really hard, flexing that foot. And release. Now you can continue to do this as many sets as is appropriate for your knee right now. But I want to do it one other variation. And this would support the function of the knee if we were standing. I'm going to keep the towel right underneath my knee. This is what can be bent or straight. Place your hands right down here, right on the top of your quadricep and your thigh, and do the same thing. Press, press, and press. You can feel how this is also focusing on your hips as well as your low belly. And then hold. And repeat. I'm going to flex my foot again just as an option. Again, you can do as many sets as feels appropriate for your body. If you want to do more, just hit the pause on your screen and continue. I also recommend doing it on the other knee as well. Okay, so I'm going to remove the cushion, the towel, and lift this left foot off the floor. Pull this leg in as close as you can by clasping your hand behind your thigh. If you can't reach, and you take a strap or a towel or a scarf and start to pulse it in and out, releasing the hamstring. And then gradually you may be able to pull it in more, really without doing anything to your knee. And hold it in, and then bend and straighten your knee. You can flex your foot, then you'll get a deeper stretch. It goes up to your Achilles and your calf. You can probably feel the hamstring tendons now right behind your knee. And try to keep that knee bent slightly, but slightly straight, and pulse it in. Good. And lower that leg all the way down. Now keep this left leg straight and lift it off the floor with the leg straight. It may only go this high. Keep your hands right on your pelvis so your pelvis isn't tipping and the pelvis remains stable. And then gradually, we start to increase the height of how you can raise that leg up. And one more. Okay, roll over onto your side. Make a little pillow with your arm or grab your towel. Hips are level and stacked. I'm keeping some space right here under my waist. And I'm going to take this right foot behind to keep the pelvis level. Flex this left leg again and lift and lower. So now we're starting to strengthen the inner thigh and stretch out your IT band. And you can continue to do as many sets of these as feels, appropriate to your level of fitness right now. And then roll over onto your belly. You can stack your hands or rest your head on your cushion or pillow. Now stretch your legs out, point your feet and toes, press down with your hips so the pelvis is not moving, and then raise that leg up and down. Keep it straight and keep the bend out of the back of the knee. Then roll over onto the other side. Stack your hips and just raise and lower the straight leg. Let's try flexing the foot so that that knee stays straight. And roll over onto your back again. Now walk your feet up as far as that knee will allow. It may look like this, but maybe you can bring your heels in closer. If you have a block, take your block and place it between your thighs. So we just want to hold it there very lightly. I'm not squeezing it, but just enough so that it doesn't fall down. This block should keep the thighs parallel. And if you look down, the center of your hip socket should line up with the center of your knee and then your ankle. Press down with your feet and lift up your hips. And lower down. And lift. And lower. Inhale up and exhale down. When you lift up, thinking of bringing your knees over towards your toes. And just stay up there, engaging all the help of the back body, the large muscles of the glutes, your hamstrings, your calf. And exhale, come on down. Remove the block, bring the soles of the feet together like we started. Bring your hands down onto your low belly. And take 5 more breaths, relaxing the hips. And bring your knees together. Roll over onto your side and use your hands and arms for support. And press back up to our seat. And so in doing this brief little set of exercises for your hips, perhaps do it 2 or 3 times a day, you should start noticing some improvement. But more importantly, become aware of how you move as we take our practice off the mat and into our life. How we stand, how we walk, how we sit, and what we do for our other activities, other sports, or whatever else we do. So as we continue on our practice today, may you all be safe, may you all be happy, may you all be healthy, and may we all live together in love and in peace. Namaste.